Hi, Paul Slackis, Good News Planet. We're going to talk this morning about quite serious concern out there. Diabetic nerve pain will affect approximately 5 million adults in 2021, and we're going to find out more about this condition. And we're honored to have today with us Lindsay Colbert. Good morning, Lindsay.
Good morning. Thank you for having me.
Executive Director, thank you, of the Foundation for Peripheral Neuropathy, and Dr. Rodica Pop-Busui. Hi, Doctor. How are you?
Good morning. Pleasure to be here.
Pleasure to be here with you as well. You're a PhD and an MD, a professor of internal medicine, metabolism, endocrinology, and diabetes, and vice chair of the Clinical Research Department of Internal Medicine at the University of Michigan, where my aunt and uncle went to. But they didn't, I don't think, had a diabetic concern. We didn't have diabetes in our family. Well, that's not so. My father had diabetes. So I want to start off first with diabetic nerve pain. It starts off, you have to be diabetic. To get first you have to be diabetic, and then from being a diabetic, you get nerve pain. How does this work?
Well, so thank you for this question. Indeed, diabetic peripheral neuropathy is a complication of diabetes. Although, since you mentioned, you don't necessarily need to have diabetes to develop neuropathy, because we have diagnosed it also in people who have pre-diabetes. So even if the blood sugar is not as high to reach diabetes level, in fact the damage to the nerve can occur, and that is the reason of this complication, a progressive damage and loss of the nerves in your body, and thus patients will start progressively losing sensation, and that impacts on their daily living, on their balance and their capability of walking. And because they lose sensation, they also are more prone to injuries in their feet. They develop ulcers that can lead to amputations. And in fact, diabetic neuropathy remains the leading cause of non-traumatic amputations in this country as well. People also experience pain. The nerve damage leads to this nerve pain that is extremely cumbersome. It can be experienced as shooting pain, burning pain, deep-seated, and it is truly very difficult to treat. It impacts on patient mood, capability of sleeping, walking, and due to the need of sometimes multiple medications, those also have important side effects. So all in all, it is truly a very challenging and devastating complication.
Let me just add, because I do have this nerve pain in my foot, okay? Actually in both feet, but mainly in one foot. But I do have pre-diabetes, but it's been after quite a few doctors, and you'll talk about that. Many people go to many doctors. They say it's more in my back. So I have, after MRIs, I have bulging discs and so on and so forth. Is where in physical therapy and other things. So that's another reality that's there on a human body.
Yeah, well, that's true that bulging disc can cause a pain that mimics the neuropathic pain. The difference is, of course, like you said yourself, that you have it more on one foot or leg and not the other. In diabetes, in fact, when it's truly due to diabetes, these symptoms and, of course, the deficits are always on both legs. In other words, they are symmetrical. So clearly, the disc problem that you have, could be, and it is completely independent of diabetes.
Of course, okay. So now you did a big research study, and Lindsay, maybe you can give us more information in that regard.
Yes, I'd be happy to. So there was a nationwide survey that was performed earlier in the year. It was conducted by an independent marketing research consultant, and those findings were reported to us at the Foundation for Peripheral Neuropathy. We found many of the findings to ring true with patients that we speak to on a daily basis. The findings suggested that patients are very fearful that the progression of their disease is just going to keep getting worse, specifically the pain from their diabetic neuropathy is going to get worse. So that was one main concern. Secondly, right now there is no current cure for peripheral neuropathy. So many times we're just trying to symptom manage what's happening. And lots of times, because there isn't a one-size-fits-all answer, people have to go to multiple doctors. The survey actually showed 3 or more doctors were a normalcy for patients. And lastly, just a combination of treatments were required. Again, there is no current cure for peripheral neuropathy, so there's no one-size-fits-all for everyone, and sometimes a combinations of treatments is required to get that symptom relief from chronic pain.
A company, this interview is courtesy of Averitas Pharmacy. Do they have some good things out there that people should consider?
Well, I'm not sure about that. I do know that the survey findings showed that lots of people reported depression, higher levels of anxiety. The survey also reported, and again, it's something that rings true with us at the Foundation for Peripheral Neuropathy, in that exercise is extremely beneficial for patients. But oftentimes, because of the impact of chronic pain, many patients can't exercise, so it's a limiting factor. And just their impact on day-to-day life, walking, driving, traveling. All of these things are really much more cumbersome for a patient who has peripheral neuropathy, and specifically one that has chronic pain as a symptom of their neuropathy.
I took a test where they poked me and poked me and poked me, these little pokies down the leg and leg and leg. So there are some tests that people can take to see also if they have peripheral neuropathy. I mean, I saw, so once I got into this, I mean, there's neuropathy departments in some of the major, I'm in Manhattan, they're opening them up, a whole department on peripheral neuropathy. So this is a serious concern, isn't it?
Yes, an estimated 30 million Americans alone live with peripheral neuropathy, and neurologists are a great resource for patients to seek further advice. I would actually refer to Dr. Rodica on this as well, but the Foundation for Peripheral Neuropathy is a great resource, and in fact on our website we have a host of information, including some of the various tests and evaluations that can be performed to truly understand the cause of your neuropathy and then better understand how to treat the symptoms affected by it.
The problem is we have too many nerves.
Perhaps.
We'll try to find the right one. Doctor, what else should we know about this?
Well, yeah, so as you said, indeed, we have quite available instruments, and we actually recommend physicians always to test these nerve functions. They can be easily done with instruments that we carry in our white coat pocket, such as tuning fork, push pins, like you mentioned yourself, reflex hammers. So definitely for diabetes, with these simple instruments, one can easily test the functions of all these nerves with larger fiber or smaller fibers. In addition, what I like to say is that, as Lindsay mentioned, although we do not have right now a drug that will reverse the nerve damage, in fact, we know that we can prevent this to occur. So I would recommend all patients to follow what their providers tell them, and particularly try to keep their blood sugars as controlled as possible, lose weight, maintain a good blood pressure, good cholesterol, and engage in a healthy lifestyle, particularly with diet and particularly with exercise. As Lindsay mentioned, exercise has been also shown in research study to prevent progression of nerve damage and also help pain. And although it may seem counterintuitive, in fact, even if you live with pain and you will try to progressively engage in exercise, that will help pain. There are, of course, several medications that have been approved by the FDA to treat specifically neuropathic nerve pain, and I would tell patients to discuss these options with their providers. Of course, each patient may require a very individualized type of treatment because all these medications may have side effects, but one important message that I would also like to highlight opioids are not effective and are not indicated for neuropathic nerve pain due to also their side effects and the addiction potential and the fact that the clinical trials didn't show benefit.
Okay. Wow, boy. There's a lot here. Is this a worldwide concern?
Yes, 100%.
Yes.
Okay. Well, America medicine is one of the finest, and working every day to improve and learn more. So the type of research that you did is part of that whole process. So if someone has some pain, first thing always is to check with your doctor and then move on from there.
Yeah, absolutely, and there are very many resources also available for patients, like Lindsay mentioned, the Foundations for Peripheral Neuropathy, the American Diabetes Association, the Juvenile Diabetes Foundation, as well as Nerve Pain and Me, for instance, and there are many more other websites that patients can consult.
Okay, great. Healthy lifestyle, too. I love what you said there. All right. Thank you both very much for sharing this important good news with us. Thank you.
Thank you for having us.
Our pleasure. Bye.
Bye-bye.